I want to go back to, I believe we have Director McCoy Wade back with us. I would love to just go back and make sure to ask you this question about what are long-term services and supports, and why are they critical? And if you can give us a quick snapshot on the background behind the master plan for aging mandate, the stakeholder process, and where things are at right now. I do want to note that we're going to try to keep our comments a little shorter,
Absolutely.
just because we're trying to stay on time. Yeah, thank you so much.
Absolutely. And I've been so happy. I have been able to hear the entire conversation, Senator Atkins, Keeley Stevenson, and it's absolutely appropriate that I go after Christina Mills because that's where we start. This is an issue that affects all of us, all ages, whether we are aging, whether we have a disability, our parents, our grandparents, our loved ones. That is why this is so important. This is the care for all of us across our lifespan. And what's really interesting about it, and part of why it's complex, but so important, is it happens in all settings. It happens when you live at home, as Christina just shared her story. It happens when you come together as you age into a group setting, whether it's senior living, assisted living, a duplex with friends. It happens in group settings too, where people might go to adult day centers. And of course, for some people, it happens in nursing homes, that more clinical health level. And for most of us, all of us are going to be needing that in some way at some time. So it's about all of us. It's about all of our homes and our communities. And the problem is we have, as I heard the governor's leadership in this area say this week, there is unfinished business in this field of adult care. Many people think we've got Medicare, we've got Social Security, adult and aging is covered. Well, we all know from our lived experience, from our lives, from our loved ones, there is unfinished business. Now, I love how Keeley started with hope. There are so many bright spots. There are so many extraordinary family caregivers in California and across the country. There are so many extraordinary high quality providers and programs and residential settings. We have got lots and lots of bright spots, but what we don't have is a seamless, smooth, coordinated system. And we knew that before COVID, and boy, do we really know it now. This has really been the ultimate stress test, and it's been too stressful. It's been too stressful for people, for families, for providers. So here's what gives me hope is that California leadership all across the board has committed that we can do better and we can finish this business. The governor's executive order, Governor Newsom, last June, this was the one issue that got named out. We're doing a comprehensive plan on aging, touching everything. From climate change to purpose, it's all there. But long-term services and supports, or as I say, adult care, was called out for a standing subcommittee, and we're so fortunate to have members of that. We also have the legislature so committed. We couldn't be in better hands with Dr. Pan, Senator Atkins, and so many other leaders in California who are committed and who've been paving the way. Our Department of Healthcare Services just finishing this actuarial study on what would it look like to follow Washington's example. So there's just so many bright spots. We have so much hope, and I'm really looking forward to continuing this conversation, hearing more about how we pull it all together to really finish the business that we all need and deserve to truly be a California for all. Thanks.